It's funny. We were just talking about this the other day, how much we take for granted, like just being able to walk across a room or even like take a deep breath.
Right.
But for people who've had critical illness weakness, those things, those everyday actions can feel impossible.
Yeah, it's really something you don't think about, until you or someone goes through it.
Exactly.
And this paper, the one you sent over about CIW, really highlights how common it is. Like a surprisingly big number of patients who are, in intensive care end up dealing with this.
So we're not just talking about like feeling a little drained after being sick.
No, not at all.
This is different.
CIDW, it can stick around, long after you're out of the hospital, sometimes for years.
Wow.
And it makes even the simplest things incredibly hard.
It sounds like it.
This paper does a good job, though, really breaking down this complex condition, making it a little easier to understand.
Okay, so let's unpack it then, because the paper keeps mentioning these three main conditions, CIP, CIM, and muscle atrophy. So what exactly are those? Help me out here.
Okay, so think of your body's ability to move as a team effort, right? Your brain's sending out signals through your nerves, and those signals go to your muscles, tell them to contract, relax, all that.
Makes sense.
CIP, it's like having faulty wiring in that system. The nerves just aren't sending those signals like they should.
Right.
But CIM, that's different. CIM is more like the muscles themselves are damaged. So even if the signals are getting through, the muscles can't respond properly.
So CIP is like the messenger messing up the message, and CIM is the receiver just not getting it or not being able to like process it right.
Exactly.
Okay, and what about that third one, the muscle atrophy? What's that all about?
That one's a bit simpler.
Okay,
Basically, atrophy just means the muscles are shrinking and weakening because they're not being used.
so like if you had to wear a cast for weeks,
Yeah.
and when it comes off, your arm is like all skinny.
Yeah, exactly. In the ICU, patients are often bedridden for a long time, and that lack of use, it leads to muscle loss, atrophy.
And that, of course, makes those everyday actions, the things we take for granted, even harder.
Exactly.
Now, the paper mentioned this MRCs thing as the gold standard for diagnosing CIW.
Right, the MRCs.
And I'm going to be honest, that sounds a little intimidating. Like, what even is that?
Yeah, it sounds complicated, but it's actually pretty straightforward. MRC-ASS, it stands for Medical Research Council's Sum Score.
Okay.
It's basically just a way for doctors to, assess how strong your muscles are in different parts of your body.
Okay, so break it down for me. How does this MRCs thing actually work?
So they test 12 specific muscle groups,
Okay.
like your biceps, your triceps, the muscles in your hands, your feet, all of that.
So a full body checkup for your muscles.
You could say that, yeah.
Oh, okay.
And for each of those muscle groups, they give it a score from 0 to 5.
Right.
0 means, you can't move that muscle at all, and 5 means you've got normal strength.
So the lower your score, the more weakness you're dealing with.
Exactly. And those scores, they directly translate to how well someone's able to function.
So like someone with weak quads, they're going to have a harder time just standing up, walking around.
Exactly. That's a great example.
Okay, makes sense.
Yeah. It can be pretty debilitating.
Now, thinking about people who are in intensive care, I imagine a lot of them are sedated, or even unconscious.
Right.
So how do you give someone a strength test when they're, basically out of it?
That's the real tricky part about diagnosing CIW in the ICU.
Yeah, I bet.
It's not always possible to do that standard MRCS test.
So what do they do? If they can't do that test, how do they know if it's CIW? What other clues are they looking for?
Right. So it becomes a bit more detective work.
Oh, interesting.
They have to use other methods.
Okay.
And that's a lot of what this research paper is focused on. What are those other ways to diagnose CIW?
Okay, so like what?
Well, one of the things they can do is a nerve conduction study.
A nerve conduction study.
Yeah, and that basically, it shows how well the electrical signals are traveling from the nerves to the muscles.
Interesting.
So it can help them figure out, is it a nerve problem like CIP, or is it a muscle problem like CIM?
So it's like checking the wiring, making sure there are no, breaks or shorts?
Yeah, that's a good way to put it.
Okay, so that's one tool they use.
Exactly. And in some cases, they might even do a muscle biopsy.
Wow, a biopsy. That seems pretty intense just to diagnose this.
It is more invasive, you're right, but it gives them a lot of information at a cellular level.
So what are they looking for in the biopsy?
They take a tiny piece of muscle tissue and examine it under a microscope.
Okay.
And by looking at the muscle fibers that closely, they can see if there's damage.
And if there is, that might point to CIM.
Exactly.
So it's really, like you said, detective work, putting all these different pieces together to get a clearer picture.
Exactly.
Now, you mentioned earlier that even the diaphragm muscle, the one we use for breathing, that can be affected by CIW.
Right.
And honestly, that sounds kind of terrifying.
It can be really serious.
Yeah.
It's often called diaphragmatic weakness, CIDW.
CIDW?
And it's really scary for patients. Imagine struggling to breathe, but it's not your lungs, it's the muscle that controls your breathing that's too weak.
And this research mentioned using ultrasound to diagnose that specific type of weakness.
Yes, exactly.
Yeah.
Ultrasound technology has come a long way.
Wow.
And now it's actually a really useful tool to diagnose this diaphragmatic weakness.
So how did that work?
Well, they can actually measure the thickness and the movement of your diaphragm muscle
Really?
just by using sound waves, which is pretty incredible. And that gives them a really good idea of how strong your diaphragm is and if it's working like it should.
Huh. So they're looking at your diaphragm in action, basically.
You got it.
That's wild. I had no idea ultrasound could do that.
Yeah, it's pretty amazing.
So, okay, let's say they've used these different methods and they've figured out, yeah, this person has CIW. What happens next? Because this paper really got into the long-term impact of it. It does. And it seems pretty intense.
It can be. Yeah, we tend to think of it as just being weak. But CIW, it has a much bigger impact.
Right. It's not just about, like, needing help carrying groceries or something.
No, not at all. It affects every aspect of your life.
Why?
Think about it. Imagine not being able to do the things you used to do without even thinking.
Yeah.
Walking your dog, playing with your kids, even just getting dressed in the morning.
It's your independence, really.
Exactly. It can be life-altering.
And on top of all that, this paper linked CIW to things like depression and chronic pain, which, wow, I can't imagine dealing with all of that at once.
It's a lot, and it makes recovery that much harder.
So is that pain, is that directly related to the muscle weakness, or is there something else going on?
It can be a combination of things.
Okay.
I mean, you might have nerve pain that's often associated with CIP.
Right.
And then there's the muscle pain from the CIM itself.
So your muscles are actually hurting.
They can be, yeah. And then sometimes you have pain because your body's trying to compensate.
Compensate.
Yeah, like if some muscles are weak, your body might try to overuse other muscles to make up for it. And that can lead to pain too.
So it's like this chain reaction, this cascade of problems, all stemming from that initial muscle weakness.
That's a good way to put it, yeah.
And it makes you wonder, what can be done? Is there any way to prevent this or treat it?
That's the hopeful part.
Okay, good.
This paper does get into some promising ways to both prevent and treat CIW.
Okay, tell me more.
And the big takeaway is that a holistic approach is key.
So not just one magic pill, but kind of tackling it from all sides.
Exactly.
I like it.
It's about figuring out what the risk factors are and then doing what we can to, minimize those risks as early as possible.
Like what? What are some of the risk factors?
Well, for example, they talk a lot about managing blood sugar levels.
Really? Blood sugar, how does that play into all of this?
Well, if you have uncontrolled diabetes, it's actually a major risk factor for CRW.
Huh. I had no idea.
Yeah, and it's because high blood sugar, it can actually damage your nerves and your blood vessels.
Oh, wow.
Including the ones that are supplying your muscles, which makes them weaker and more likely to atrophy.
So keeping those blood sugar levels in check is crucial.
Absolutely.
What about other parts of this holistic approach? I know the paper also mentioned something called early mobilization.
Yes, early mobilization is really important.
So what is that exactly?
It's basically just getting patients moving as soon as it's safe to do so.
Okay.
Remember how we talked about how atrophy happens when muscles aren't used enough?
Right, like the cast example.
Exactly. Well, early mobilization, it helps to fight that.
Okay.
By getting those muscles working, it keeps them from getting weaker.
So even just like sitting up in bed or doing some small exercises can make a difference.
Absolutely. It makes a huge difference. It gets those muscles activated, gets the blood flowing, and helps prevent them from getting worse.
And how much they can do, that depends on the patient, right?
Of course, it all depends on their condition and what stage of recovery they're in.
Right, because I imagine there's a fine line there between encouraging movement and pushing someone too far too fast.
Exactly. It's all about finding that balance, which is why it's so important to have a good physical therapist involved.
To help figure out that sweet spot.
Exactly. They can assess what the patient is capable of and create a plan that gradually increases their activity level without putting them at risk.
That makes sense. So it sounds like we've got managing blood sugar and early mobilization as two key parts of this holistic approach.
That's right.
What else plays a role in all of this?
Well, we can't forget about nutrition.
Oh, right, of course. Because when you're recovering from something serious, your body needs the right fuel.
Exactly. You need the right nutrients to rebuild that muscle tissue, to regain your strength.
So it really is about what you eat.
It really is, yeah. And this research really stressed the importance of a balanced diet, making sure you're getting enough protein, especially.
Protein, the building blocks.
Exactly. Think of protein as the building blocks for your muscles.
Because if you're not getting enough, your body can't rebuild those muscle fibers.
Exactly. It's like asking a construction crew to build a house, but not giving them enough bricks and lumber.
I like that analogy. It paints a very clear picture.
Good, good.
So protein is key. What about other nutrients?
They're all important, your vitamins, your minerals. They all have a role in how well your muscles function and how well you recover overall.
So it's really about giving your body everything it needs to heal properly.
Exactly.
Now, I remember reading something in here about stem cell research, and I have to admit, that always sounds so futuristic to me.
It does, doesn't it?
Like, are we living in a sci-fi movie?
I know, but it's a really promising area of research, especially for treating CIW.
So how would that even work?
Well, stem cells, they're pretty amazing. They can actually develop into different types of cells.
Right, I've heard that.
And researchers are trying to figure out how to use that ability to regenerate damaged muscle tissue.
So instead of just managing the weakness, they could potentially, like, reverse it.
That's the ultimate goal, yeah.
That's incredible.
It is.
Is that something that's, like, close to being a reality?
It's still early stages,
Okay.
but there have been some really encouraging results, at least in animal studies.
Wow. So it could be a game changer down the line.
It really could.
That's amazing. So for now, though, it seems like the focus is on prevention and these holistic approaches we've been talking about.
Exactly. And this research really highlights just how important early intervention is.
Because once the damage is done, it's much harder to undo.
Right. But by recognizing those risk factors, addressing them quickly, and using these multifaceted strategies.
Right. Tackling it from all sides.
Exactly. It can make a world of difference for the patient in the long run.
Because as we've been discussing, CIW, it's not just physical weakness. It impacts every part of a person's life. Their mental health, their emotional well-being, their ability to work, to socialize, to do the things they enjoy.
It affects everything.
It's really about raising awareness, isn't it? The more we understand CIW, the better equipped we are to advocate for ourselves, for our loved ones, for better screening in hospitals, for more comprehensive rehab programs, for greater support for survivors.
Absolutely, because CIW doesn't just end when someone leaves the hospital.
Right, it's an ongoing journey.
It is, and it requires ongoing care, support, and a lot of resilience.
You've given us a lot to think about today.
I'm glad to be here.
This deep dive has really opened my eyes to this condition. It's complex, it's often overlooked, and it highlights the need for continued research, for innovation, for compassionate care for those who are impacted by CIW.
I completely agree.
It's a powerful reminder that sometimes the most profound journeys, they start with just regaining the strength to take that first step.
Well said.
And that's all the time we have for today's deep dives. But as always, we encourage you to keep exploring, keep learning, and keep asking those questions.
It's really pretty amazing, actually. They can use sound waves to measure the thickness and the movement of the diaphragm.
So they're basically watching your diaphragm in action.
Pretty much.
That's incredible. I had no idea ultrasound could even do that.
It's come a long way, that's for sure.
So let's say, okay, they've used all these different methods, nerve conduction, biopsies, ultrasound, and they figured out, yep, this person has CIW, what happens next?
Right.
Because this research paper, it really dove into the long-term effects of CIW, and it's honestly a little daunting.
Yeah, it can be, we often think of it as just being weak.
Right, like, oh, you just need to get your strength back up, that's it.
Yeah, but CIW, it goes way beyond that.
Right, it's not just about, like, needing help carrying groceries up the stairs.
Exactly. It's so much more than that. It can impact every aspect of your life.
Wow. So what are we talking about here? What kinds of things?
Well, just imagine, not being able to do the things you used to do without even thinking twice.
Right, like it becomes this huge effort.
Exactly. Things like walking your dog, playing with your kids, even just getting dressed in the morning.
Your independence, basically.
Exactly. It can be really life-altering.
And it's not just the physical stuff, right? This paper actually linked CIW to things like depression.
Right, and anxiety.
And chronic pain, which, wow, I can't even imagine dealing with all of that at the same time.
It's a lot to handle. It's no wonder that recovery can be so much harder when you've got all of that going on.
So is that pain, is that directly because of the muscle weakness, or is there something else that's causing it?
It can be a few things,
Oh,
actually.
right.
Sometimes it's nerve pain, which, we see that a lot with CIP.
Right.
And then there's the pain that comes from the CIM itself, like your muscles actually hurting.
So the muscles themselves are in pain.
Yeah, and on top of that, you might have pain because your body's trying to compensate for the weakness.
Compensate how?
Well, if some of your muscles are weak, your body might start overusing other muscles to try to make up for it.
Oh, interesting.
And that can lead to pain as well. So it's really this whole chain reaction.
Like a domino effect,
Yeah.
one thing leads to another.
Exactly. And it all stems from that initial muscle weakness.
Which is wild to think about.
It really is. The body's so interconnected.
Yeah, and with something like CIW, it seems like it just throws everything off balance.
That's a really good way to put it. Yeah, it disrupts this delicate balance that we often take for granted.
Right, until something like this happens.
Exactly. And that's why it's so important to talk about it, to raise awareness so that people know what they're dealing with and can get the help they need.
Absolutely, because it's not something you just like push through or ignore. It's serious.
It is serious, and it deserves attention and care.
So we've got managing blood sugar, early mobilization, really focusing on nutrition, giving your body what it needs to repair those muscles. It's, like you said, a whole team effort.
It really is. And something else that came up in this research that I found really fascinating was the whole area of stem cell research.
Oh, right. I'd almost forgotten about that part, stem cells. That always seems so futuristic to me, like something out of a movie.
I know, right? But it's a really promising area of research, especially when we're talking about treating CIW.
So how would that even work? Like, how do stem cells fit into all of this?
Well, stem cells are pretty amazing in that they can actually develop into different types of cells.
Right. Like they have all these different possibilities.
Exactly. And scientists are trying to figure out if we can use that ability to actually regenerate damaged muscle tissue.
So instead of just managing the weakness, they could potentially, like, fix the problem at the source.
That's the hope, yeah.
Wow. That would be, is that something that's anywhere close to being a reality?
It's still early days, a lot more research to be done.
Right.
But there's already been some really encouraging results, at least in animals.
That's amazing. So it could be a real game changer down the line.
It really could. It's definitely something to keep an eye on.
So it sounds like, for right now, the focus is on these more holistic approaches we've been discussing, prevention, early intervention, all of that.
Exactly. And, this research really drives home just how crucial that early intervention is.
Because I imagine once the damage is done, it's a lot harder to reverse.
Exactly. It's much more effective to try to prevent it in the first place, or at least catch it early and start taking action right away.
Makes sense. So recognizing those risk factors, addressing them quickly, and then using these multi-pronged strategies.
Right. Tackling it from all angles.
It can make a huge difference for someone dealing with CIW.
Absolutely. It can really impact their recovery and their quality of life long term.
Because as we've been talking about, this isn't just about physical weakness, CIW. It affects every aspect of your life, your mental health, your emotional well-being, even your ability to work, to socialize, to do the things you love.
It really does touch everything.
It's about recognizing that this is a serious condition, that it deserves attention, it deserves research, it deserves compassionate care for those who are dealing with it.
I couldn't agree more. And it's about raising awareness, too, The more we understand CIW, the better equipped we are to advocate for ourselves, for our loved ones.
Right, to push for better screening in hospitals, more comprehensive rehab programs, more support for survivors.
All of that. And it starts with having these conversations, with shedding light on this condition that's often overlooked and misunderstood.
Exactly, because CIW doesn't just end when someone leaves the hospital. It's an ongoing journey.
It is, and it's a journey that requires ongoing care, support, and a whole lot of resilience.
Well said. You've given us so much to think about today. This deep dive has really been eye-opening for me. It's given me a whole new understanding of this complex condition.
I'm glad to hear that. That's what we were hoping for.
It really highlights, the importance of continued research, of innovation, and of making sure that people who are impacted by CIW are getting the compassionate care that they deserve. It's a powerful reminder that sometimes the most profound journeys begin with just regaining the strength to take that first step. And that's something we can all relate to in one way or another.
That's a beautiful way to put it.
Well, that is all the time we have for today's deep dive. But as always, we encourage you to keep exploring, keep learning, and keep asking those questions.